Yes. Okay. All right. So Sindhu, if you don't mind, can you unmute yourself and tell me a bit about listening party? Yes.
Yes, ma'am.
Yeah.
Listening part A consists of 24 questions, and in this, we'll get two parts. There are two parts. Each part consists of 12 questions, and in that, basically, there will be a consultation, or a patient and a doctor will be there mostly, in which the patient has come for a consultation with the doctor, wherein the patient has been asked for his past medical history and medications and past disease condition, and about any history of allergy and everything. It will be a two-way conversation, in which we can find different abstract in that, in which first of all it will be mentioned like present complaints or symptoms and past medication, and everything will be mentioned. We
Okay.
have to just read the main headings, and we have to underline the main key points, and then we have to assume, or we have to find out the exact word or exact word that they have talked. Maybe they will be talking in a synonym form. We have to find what is exactly they are talking about.
Okay, so more or less what you have told is correct. So let me just rephrase the same thing and add a few more details. So part A, here we go. Right, part A has two audios, which these two audios are consultation. So listening. The whole test lasts for a maximum 45 minutes, minimum 38-39 minutes. It depends. The whole test has three parts: A, B, C, and it starts with part A. Part A consists of two different audios. These audios are consultations. So as medical professionals, all of you are very well aware of what are consultations. Consultations are interactions between a medical professional and a patient. So you get two consultations that are completely different. If first one is between an ophthalmologist and a patient, the second one can be between a midwife and a patient, or it can be two completely different scenarios with two completely different patients. And before the audio starts, you get 30 seconds to go through your questions, which are gap fills. So basically, you need to fill the gap in the consultation for part A. And for each question, for each audio, you get 12 questions, which means total you will be answering 24 questions for part A. Okay, so all of you take a second, go through what I've written on the screen, especially those who have joined today. All of you. All of you. Right. So in part A, the best way to approach part A is all about prediction. So when you get this 30 seconds, what you do is you read the main headings. So consultation, the content of both consultation, the scenario for both consultation, both are completely different. So when you get a when you get your part A consultation, during the 30 seconds, what you need to do is you start with the main headings. There will be headings written in bold this one on the side. So you need to read the headings first. So that will give you a rough idea about the structure of the consultation. What are the topics that they're covering during the consultation? So you start reading the heading on headings which are bold headings that you will read. Then you will go through each question. When it comes to each question, that means each gap fill, you will look at the words before the gap and after the gap and try to think what is going to be your answer. What type of word will be your answer for each question? This is what prediction is all about. You read the headings, then you go through each question, the words before and after the gap fill for each question, and you try to think, try to understand, try to predict what type of word will come as your answer. So doing prediction, what I've just told you now, will help you. So basically, you are listening to something completely new. So when you do prediction, that is when you use the cues that's given to you in the question paper, starting with the headings and the words before and after the gap, it will make you become more acquainted, get more familiar with the audio, even though you haven't listened to it. So when they play the audio, you will be able to understand the meaning quickly, understand get the answers quickly. So that is the goal of prediction. All of you, take a second, go through what I've written on the screen. First 2 points, all of you. So please do not underestimate prediction. Prediction is all about going through your headings, going through your question, and try to predict what is going to be your answer. What type of word can come as your answer for each question. And remember, yes, I agree, both audios, you get 30 seconds to prepare. So doing a thorough prediction during 30 seconds, it takes practice. It takes, good speed reading. All those comes into picture. However, for the first audio, for the first extract, the first 12 questions, they will allow you 30 seconds. Other than the 30 seconds, you can also get some extra 1 minute or 1.5 minutes, because at the start of the audio, they will give you an introduction to the test in general. So they will say, this is listening test. Listening test has 3 parts, starting with part A, part B, part C. Part A has these many things. They will give all these intro to the test. You're familiar with it, so you don't need to pay attention to that. So you can utilize the introduction time that they give, the time that they give to give introduction to the test. You can also utilize that time to read your questions for part A, first extract. Okay, Maria, Sindhu, Jesma, Rajan, Viji, Rohan, Tristan, Cicely, Rachel, Manu, Lavina, Anusha, Seema, Donna, Bibi, all of you, go through what I've written on the screen about prediction, every single point, and ask me if you have any questions. All of you. Extremely important.
Excuse me, ma'am. Regarding look at the words before and after. So we have to look for any grammar word also, ma'am.
Like yeah, sometimes yes. Since it's gap fill, yes. Since it's gap fill, grammar matters. But what you write, the form of the word matters. Okay, so we will do that in a second, so you will get a better idea. Yes, grammar matters since it's a gap fill.
Okay.
All of you, go through it. Okay, all right. So we are going to look at the extract for today. Here we go. We will be doing among 2. We will be doing 1 extract today. Here we go. This is the question. Yes. Okay. Let me take the right. So Levina, if you don't mind, can you unmute yourself and read this for me? What I've highlighted on the screen. Make sure to unmute yourself so I can hear you. Okay, all right. Rajan, can you unmute yourself and read this for me? Yes.
Yes, ma'am.
Yeah.
You hear a consultant endocrinologist talking to a patient called Sarah Koff for question number 1 to 12. Complete the notes with the words or short phrase.
Okay. So here, today's the consultation is with an endocrinologist and a patient. So endocrinologist and a patient called Sarah Croft. So let's do one thing. Let's look at the structure. I want all of you to read the bold headings over here. All of you read the bold headings as they appear on the screen. I have highlighted them. Just look at the headings. All the headings. Here we go. Okay. We have other 2 headings as well. Just the heading, nothing more, nothing less. Okay, all right. Okay. So once again, Seema, can you unmute yourself and read the first 2 headings for me, please?
First, yes, ma'am.
Yeah.
First heading is patient and medical history.
So, okay, so the thing starts with the consultation starts with the patient's name, then they move on to medical history. So, Seema, usually what are the things that gets covered in medical history under the heading medical history? Usually in a consultation, what are the things that they discuss when it comes to medical history?
In the medical history, they are discussing about past medical history, such as diabetes, hypertension, or any other past surgery,
okay,
medication, something like that, medications.
Okay,
all these
correct.
things.
So past medical history, any conditions the patient has, what medication the patient is on, how long the patient has had these problems, and whether the patient has undergone any specific surgeries, all those things. So, yes, we have not listened to the audio, but from the first heading, it's clear that it starts with patient name, then it moves on to medical history. Then next two headings, Cicely, can you read the next two headings?
Yes, ma'am. General symptoms and dermatological symptoms.
So what are general symptoms, Cicely? General symptoms. What do you understand by the phrase general symptoms?
Any symptoms that is visible or like any swelling is been there.
Yes, overall, right? Overall symptoms. What are the overall problems? Then when it comes to dermatological, it becomes dermatological means what, Cicely? Dermatological.
It's on the skin.
Skin.
Normally in
yes.
Skin.
So see, the audio starts with medical history, then they move on to overall symptoms, then they focuses on the patient's skin. All right. Biji, can you unmute yourself and read the last two headings for me, please? Yeah. Yes. These two headings, this one and this one.
Okay. Psychological symptoms.
Psychological symptoms. One second. Psychological symptoms. So, Biju, what do you understand by psychological symptoms?
Patient have any psychiatric or depression or
emotions, right? Emotions. How does the patient feel? Right? When it comes to psychological, it all comes down to emotions, feelings, and all those things. Then final last heading, BG, can you read that once again?
Recommended test.
So recommended tests. When you say recommended test, are they talking about past tests or future tests?
No, future test.
Future. What are recommended? What tests are recommended for the patient in the future? So all of you take a second, go through the headings once again. It starts with medical history, then it focuses on symptoms, starting with general symptoms, dermatological symptoms, psychological symptoms, then it moves on to recommended tests. What tests are needed for the patient? Future tests. Okay, are all of you clear about the structure of the audio? All of you?
Yes, ma'am.
Okay, all right. So let's start with the first question for today. So under medical history, the first question. Okay, Maria, if you don't mind, can you unmute yourself and read the first question for me? This one? Yeah. Yes, Maria? Yeah.
3 years of corticosteroid treatment for
dash, right? 3 years of corticosteroid treatment for dash. So 3 years of corticosteroid treatment for dash. So my question is, Maria, after the word for, what answer is, what is going to be our answer? Treatment for?
duration.
Is it duration is already given, right? 3 years of corticosteroid.
Disease condition.
Disease condition.
Disease condition.
Yes. We are looking for the name of the condition. Treatment for what? Name of the condition. Name of the condition. So that brings me to two things. Okay. The first thing, let me tell you, this is the one. Whenever in your question, you get the preposition for. Okay, 1 second. There are people coming in. Let me just admit. Yeah. Whenever, just before the gap, you get for, the preposition for. Remember, after for, you can expect a noun. Noun is the name of something. So here we are looking for a name of the condition. Or you can also expect a verb in ing form. For, after for, you can expect a noun. Noun is the name of something. So here we are looking for name of the condition. Or you can also expect, after for, you can also expect a verb. If you're writing, verb is an action word. If you're writing an action word, it will be in ing form. Okay, so that is a grammar aspect that you need to know whenever it comes to gap fills. Another one thing, as you can see, 3 years. So this is a time reference. This is a time reference. So whenever time reference comes into picture, I need your full attention here, all of you. Whenever time reference comes into picture, expect the order to be different. Let me clarify what I mean by that. Okay, I'm going to say an example. I need your full attention. Then I can say, yesterday I talked to Anusha. I can say, yesterday I talked to Anusha. So yesterday is a time reference. I started my sentence with it. That is also correct. What I told is grammatically correct. However, I can also say the same sentence. I talked to Anusha yesterday. See, time reference is something that you can start your sentence with or you can end your sentence with. So whenever you have a time reference in your gap fill, remember, so in our question, the question starts with the time reference. However, in the audio, you can expect the sentence to end with the time reference. So don't be like, okay, after 3 years, after they mention 3 years, you will get your answer. Not necessarily. So don't be like, okay, after the word 3 years, after the word treatment, I'll get my answer. They can also say, for this particular condition, I've been taking treatment for 3 years using corticosteroids. They can also say that. So don't be like exactly after the word 3 years of this one, you will get your, no, nothing like, no, it's not like that. Because time reference, whenever you construct a sentence and when you speak a sentence, remember time reference is something that you can start your sentence with, that you can also end your sentence with. So the order, usually, I'm not saying every single time, I'm saying most of the time there is a possibility that the time reference, the order can be different when you compare that with what is given in the question booklet. So the first question, we need to find out for what condition the patient has been receiving corticosteroid for 3 years. So I told whenever you get 4 before the gap, expect a noun or a verb in ing form. Noun is names of things. And I told you whenever there is a time reference, the order in which the time reference is said or mentioned can be different to that of what is given in the question booklet. Tina, Anusha, Manu, Sindhu, PG, Christian, Cicely, Lavina, Rajan, Jasma, Bipi, Maria, Seema, all of you, just go through what I've told you right now. Just, go through it and ask me if you have any question. So basically, don't expect everything to be in the same order. Okay? All right, moving on to the next question. Levina, if you don't mind, can you read the next question? Please take your time, unmute yourself and read the second question for me, this one. Yes.
Yes, ma'am.
Yeah. Can you read that?
Yes, ma'am. Medical history, ma'am.
This one, second question. Can you see the second question? I've highlighted it now.
Yes, ma'am. Gradual weight gain.
No. This is the second question. This one. Okay.
Dash on face. Embarrassing.
Dash. And so what are we looking for? What are we looking for here?
Facial condition.
A problem. Yes. A problem. A sign or a problem on the patient's face. A problem. Okay, so we are looking for a problem on the face. Now, so we don't have any other. So after she talks, so 1 second, let's look at the words before the gap. After she talks about her stomach, then after that you can find your answer, which is a problem on the face. That brings me. So we know before the gap we have stomach area. After she talks about that, then you get your answer. However, see this word on the face. That is a location. So I can say, okay, my patient has redness on her face. That is correct. My patient has redness on her face. Or in spoken language, I can also say, on my patient's face, there is redness. So again, similar to time reference, when it comes to spoken language, especially when it comes to spoken language, location can be placed in order can be different. So whenever you get location, here location being the face, remember order can be different to that of what is given in the question booklet. Here we get the problem, then they mention the location. However, in spoken language, they can mention the location first, then give you the problem. Okay, so remember here before the gap, we don't have any specific word. So this is an indicator. You can take this as an indicator. After the patients or after the conversation is done with the stomach, they will move on to our second question, where we are looking for a problem on the patient's face, which is causing her embarrassment, right? So on face, it's a location. So remember, they can start with the location, then present the problem, or they can mention the problem, then mention the location. So don't be like, okay, before phase, you will get your answer. No, don't think like that. Okay, so all of you take a second, go through what I've told you about the second question. All of you. Okay, I hope all of you are with me so far. Third question. Okay. Tina, can you unmute yourself and read the third question for me?
Yes, ma'am.
Yeah.
Visible dash between the shoulders.
Visible dash. Visible dash. What do you say for visible? What are we looking for here? Visible.
A problem.
A problem, right? We are looking for a problem, a visible problem between the shoulders. Again, you have location between the shoulders. So expect the location, the order to be different. Whenever you get, again, you have another location here between the shoulders. So expect the order to be different. Now, I want you to focus on the word before the gap. Tina, can you read the word before the gap? Before the gap? This one? Unmute yourself so I can hear you.
Yes, ma'am.
What's the word here?
Visible, something which is seen.
Something. So instead of saying visible, can they use any other word instead of visible?
Found.
Found. Okay. Anything more found? More close to visible. Seen. Yes. Anything else?
Notice.
Noticed or noticeable. Okay, all these words, they can use these words. So do not expect them to use the same word that came before the gap. They can use the same word, or there is a possibility that they might use some other word. So here, instead of visible, they can say seen or clearly seen, noticeable. Okay, all right. So here we know on the third question, we are again looking for a problem that happens between the shoulders. So that means again you get location. So whenever you get a location, remember the person can say between the shoulders, I have this problem, or they can say I have this problem between the shoulders. So location means order can be different, can differ. Okay, all right. Okay. Sindhu, can you read the fourth question for me?
Yes, ma'am. Excessive and constant dash.
So again, excessive and constant. So what are we looking for here? Again,
some issue.
Problem.
Some issue. Again, some issue, some symptom. Yes. So again, some symptom or an issue. Okay. All right. My question is, one second. Yeah. Right. Okay. Some issue or some problem. Okay. Right. Now, look at the words before the gap. Sindhu, can you read the words before the gap?
Excessive and constant.
Is there any other words are there any other words we can use instead of excessive and constant?
Increased and continuous.
Okay, increased. Okay, anything else? Increased and continuous. Do we say repetition when it comes to a problem? Repetition, constant. Any other constant? Is repetition?
Continuous.
Too much and always, right? Anything else? Too much. Yeah, excessive or too much, right? Or any other word instead of too much. Increase, I take increase, I'll take too much. Any other word?
More.
Okay. Anything else? Very common, a lot or lots of, right? Always is, continuous, always, constant. Anything else instead of constant? Can you say any other word for constant? Constant. Frequent, is it frequent means comes and goes? Constant does not come and go, it's always there. Is there any other word for constant?
Continuous.
Continuous we have already written. Any other word? Any other? Very common in medical vocab. It starts with a P. It starts with a
persistent.
Yes, persistent. Okay, persistent, it's always there. Okay, so remember, they can use the same word, so there is a possibility that they might use the other synonyms, such as, for excessive and constant. So we are looking for a problem that's too much and that's always there. Okay, so all of you take a second, go through the fourth question, all of you. Okay, all right. Christine, if you don't mind, can you unmute yourself and read the fifth question for me? Okay, that's all right. Seema, can you unmute yourself and read the fifth question for me, please?
Periods are dash.
Periods are dash. So now we are focusing on the patient's periods. So what do you think they mention about the periods?
Flows.
Flow, how it is, right? How, basically, how is her period? How? So how it is, how is the flow? Is it, a frequent? Is it, or she has an issue with the bleeding? Is it too much bleeding? Periods, how? So we are going to get how the periods are. Okay, so instead of periods, can they use any other word, nurses? Instead of saying period,
cycle.
yeah, menstruation, you're right, menses or whatever they can say. Okay, so they might not use the same word, they can use menstruation, or menses. All right, all those things. So menstruation cycle, whatever. Okay, so all of you take a second, go through this. Please go through this. Okay, all right, let's move on to the sixth question. Now we are moving on to the dermatological, the skin, the problem with the skin. Okay, Rajan, can you read the sixth question for me, please? Unmute yourself so I can hear you. Can you read the sixth question?
Tendency to dash.
Tendency to dash. So you should, let me add a detail. So whenever you get a preposition to, you can expect after to, of course, you can get a noun, name of something, or after to you can get verb in its plural form, plural V1 form. V1 plural. That means without s. We never say to des, it's to do. So always V1 plural form. V1 plural form. Okay, plural form means without the s. To do, not to des. To give, not to gives. So without the s, you can get. So whenever you get a preposition to in a gap fill, you can expect the word to be. If it's a verb, it will be in V1 plural form, or it can be a noun. So tendency to. So what are we talking about here, Rajan? Tendency to. After to, what type of word? Of course, it's a problem, right? So the problem, we are looking for a problem. Yes. Okay. I want you to, can you read the word before the gap? This one, Rajan?
Tendency.
So instead of tendency, can we use any other word there? Instead of tendency, any other word? Think about it. All of it. Yes.
Usually.
No, tendency to. It's not it's tendency. Tendency. What do you mean by tendency? Tendency.
Feel like.
Yes. You feel like. Okay. Feel like. I can take feel like. But do we say feel like? Okay. Any other word? Almost close. Feel like. Anything else?
Proposition.
Yes.
Proposition.
Yes. What is it?
Felt.
Felt. Okay. Felt to. No, not exactly. We are talking about dermatological, something that appear on the skin. Tendency to. We can say tend to.
Like feeling.
Tend to. Okay. But okay, please remember, when I ask you for a word, I'm looking for instead of tendency. Can I replace tendency to with a feeling to? No, right? So look at the word instead of tendency. Yeah.
Possible to.
Possible. Yeah. Possible. Okay. But anything else? Possible. Yeah. Tendency to, tend to, possible. Something much more.
Development.
Develop. Yeah. That is a good one. Develop. Something can develop. Okay. All right. So tend to or develop. That would suffice, I guess. Okay. All right. Cicely, can you read the seventh question for me, please?
Yes, ma'am. Wound slow to heal, dash on thighs.
Okay, so I want you guys to focus here. So we are looking for a problem on thighs, right? So
Yes.
All of you, I need your full attention. Wounds slow to heal, dash on thighs. So there is a comma. Wounds slow to heal, comma, dash on thighs. So what does the comma indicate? When I say things with commas, 1 comma, 2 comma, what does that mean? What am I doing there? Yes?
Some other issue.
Ending the sentence.
No. When I say she is taking tablet X, comma, tablet Y, comma, tablet Z, what am I doing there? I am
Splitting.
Continuing the medication.
I'm listing. So see here, wounds slow to heal, dash on thighs. So here we are looking for a problem on thighs, and remember, this is a list. So whenever lists are involved in OET Part A listening, the order can be different. The order can be different. So they might say the problem with on the thighs first, then they mention the wounds. So, or maybe they might say the same order. So, but this is a common trend in OET listening. Whenever they list things, they tend to change the order compared to what they have given in the this one. Oh, also another problem here. Again, we have location on thighs. On the patient thigh. So again, we have location. Location, I've already told you, whenever there is a location, that the order also, you cannot expect they will say the problem, then they will mention the thighs. Not necessarily. They can mention thighs, then they can mention the problem. So you need to pay close attention. Okay, so here two trends in OE. That's what I want to highlight. This is a list. So whenever there are lists, so see, it continues the list. Again, we have another list in the next question as well. So whenever you get a list in OET listening part A, remember they can mix and match the order. So be very careful. Another one thing which I've already mentioned, whenever you get a location, the order can be different. All of you, Tina, Anusha, Manu, Biji, Christine, Cicely, Rachel, Levina, Rajan, Jesma, Sindhu, Seema, Maria, Bibi, all of you, take a second, go through the 7th question. The comma told us that we are reading a list. So whenever there is a list, remember the order can be different. Or 1 second. They might add extra things. Extra choices can be added there. Extra choices can be there. So they might say wound slow to heal, another problem, blah, blah, blah. But we are looking for problem on thighs. So be very careful. So when there is a list, the problem is, two different levels. The order of the list can be different, or they might add something that we don't need. So you need to be very careful. You need to read what you need to pay close attention. You need to know what you're looking for in order to get your answer quickly. Okay, all right. Next question, Jesma, if you don't mind, can you unmute yourself and read the 8th question for me, please?
Yes, ma'am. Face appears red in color, comma, dash area on neck.
So, face appears red in color, dash area on neck. So, what are they? Are they talking about a problem? Or is it a bit more specific than a problem? Dash area on neck. Dash area. So now they are describing
location.
They are describing the area. So look, we are looking for an adjective. We are looking for an adjective. Adjectives are word or phrase that describes a thing. So here we are looking for an adjective. So you can get a common adjective, very common one, like, yellow, or, the area, red area, or pinkish area, or, so you can get a common adjective, or the common type of adjectives that you find in OET part A is, or you can get adjectives that end in ing or ed. So look out for, they are describing the area that is on the neck. Again, this is a list. So remember, order can be different. They might add extra choices before they get to answer. Then again, you have location. Again, you have location in the location. So not only the order of the list can be different, not only there is a possibility of extra choices, it is also possible that they might mention the neck first, then they might describe it. Okay, all right, so all of you take a second, go through the questions. Okay, final one more, then we will look at the whole thing again. So Viji, can you unmute yourself and read the 9th question for me, please?
Okay, ma'am. Recent development of.
Recent development. So let me tell you, after the preposition of, you can expect a noun. So here, name of the problem. Recent development of what? That what can be a name of something. Or after of, if it's a verb, remember, it's going to be in ing form. It's going to be in ing form. Okay. So recent development of some problem on the skin. So it's a recent development of something. So that after of, you can expect the name of that thing, or if it's an action word, you need to write down that in ing form. Now, Viji, can you read these words for me once again?
Recent development of.
So they are talking about something developed on the skin recently. So is there any other different way to say recent? Any other words for recent? Seema, Tina, Anusha, any other words? Sindhu, Jesma?
Currently.
Is currently recent? Instead of saying recent, what can I say? Recently, I visited Paris. Recently, I visited Paris. Can I say any other word? Some time ago?
Latest?
No, not latest. Some time ago. No, not latest. Latest is very new. I'm talking about recent. Some time ago. Anything else instead of recent? A while ago. While ago. Okay. So all these things can be used instead of recent. Any other words that I've missed out on? Some time ago.
Ma'am.
New. No. New is like brand. That is different. Recent. Recent. It happened, recently.
Few days.
Okay, a few days ago. Okay, a few days ago. Can we take, yeah. All those. Instead of development, developing something developing on the skin. Can I use any other word instead of development?
Notice.
Appeared.
Appeared. Yes. Appeared. Yeah. You can also say notice. Yeah, you can take that. Okay. So expect all these things. So all of you take a second, go through this part, our dermatological symptoms. It was a pretty complicated. Please go through our predictions here, all of you. Remember, on the exam day, you cannot write all these down. These are all the things that you should notice when you go through your questions during that, 30 seconds or, for the first audio, a bit more time is. So during that time, all these things should come to your mind. Okay, the purpose of prediction is to, make yourself aware of the audio as much as awareness that you can before you listen to the audio. So you know what to expect. You know what you thoroughly know what you're looking for. So that way, irrespective of what accent they are using, you should be able to get your answers. That's the goal. All of you take a second, go through it. Okay, all right. I'm moving on to the next 10th question. Lavina, can you read the 10th question for me?
Yes, ma'am.
Yeah. This one.
Scared by new experience of.
Scared by new experience of. So it's a new problem, right? A problem. Problem or symptom that we are looking for. Again, we have of here. So whenever of comes into picture, a noun or verb in its ing form. We have just discussed that. Okay, whenever of comes into picture, of plus noun, name of the problem, or you can expect some. If it's an action word, it can be in ing form. Okay, all right. Now I want you, Lavina, can you read the words before the gap here?
Scared by new experience.
So let's start with the first word. Instead of saying scared, what other words can we use instead of
Fear.
Fear. Okay. Fear. Afraid. Yes, I'll take that. Anything else? Anything else?
Frightened.
Frightened. Good one. I'll take that. Frightened. Anything else? Terrified. When you're terrified, you're afraid, right? You're terrified. So you can expect they might not use the same word. So you can expect all these things. New. Any other word? Any other way to say new?
Fresh.
Fresh.
Fresh, but do you say fresh experience?
No. Current.
Current, that is now. or not so long ago. They can say not so long ago. They can say that. Recent experience can, here recent also works, but their recent, new doesn't work. Okay, so here new, recent. Okay, all right. Basically, that's it. Okay, all right. 11th question as well, Livina. You can read the 11th question as well.
Yes, ma'am. Feels constantly.
Feels constantly. So what are we looking for here? Patience?
Issue.
What issue? What type of issue? Feels constantly. So what are we looking for?
Something often she is.
So we are looking for the feeling, right? We are looking for the name of the feeling. How does she feel? Feeling how? In what way? Right? Feeling how? So instead of constantly, what other word can we use? We already discussed this. Come on, tell me. Instead of constantly.
Continuous.
Continuous. Anything else? We just always, or constantly, always, continuously.
Persistent.
Persistent. Yes, continuously or persistently. Oh, one second, I messed up the spelling. Yeah, yes. Or you can also say persistent. Persistently. All those things. Okay. Okay. All right. So here we are trying to figure out the patient's constant feeling. How does the patient feel constantly? What is a persistent feeling? Okay. All right. 12th one. Anusha, can you read the last one for me, please?
Yes, ma'am.
Yeah.
Dash test possibly.
So we are looking for the name of what are we? Name of
A test.
Test, correct. But one second. Yeah, we are looking for the name of a test, but one second. We have another word we have to analyze here. That being, one second. Oops. Yeah, give me a second. Yeah, the word being possibly. Is there any other way to say possible or possibly?
Possibility.
Might. We may need. We might need. So might, may. Anything else? Likely, probably. Sometimes suspect.
Maybe.
Okay. Or one second. Maybe, maybe already, might be already, likely, probably, suspect, assume. Okay, so these are all the words that they often use to say possibly. Now I have one more question. We are looking for the name of a test, possible test. Do you think the patient will say the name of the test?
No.
Who will give it? By the doctor. By the doctor. So doctor can mention by the doctor. Okay, so yeah, yes, remember, usually you get the answers from the patient side when it comes to listening part A. However, there is a possibility that certain topics, especially that has medical jargons or medical aspects involved, you can expect the doctor to say it. So this one, you can expect the doctor to say it. So all of you, we have covered all the question. I know it was pretty long. I want all of you to go through each and every prediction that we have made so far. All of you. Starting with the first 5 questions. All of you. Do not leave anything out. Do not leave anything out. First 5 questions, whatever I've told you. Okay, next 10 questions, next 6 to 9 question. Please go through it. Question number 6 to 9. All of you. Okay. All the predictions about the list, about the word's tendency, about, all these things. Okay, please go through the last 3 questions. Remember, whenever you do prediction, it happens in your mind. So all these things, when you read, it should click for you. This is how they think about. This is how they analyze. Or whenever if you're an English speaker or if you're a candidate, this is how you should analyze your gap fills. Okay, all right. So what I'm going to do now is I'm going to play the audio. I will play the audio twice. I will play the audio twice. Try to figure out as many answers you can. Then after once I'll play it, then I'll play it once again. After that, we will discuss the answers. Okay. And if anything is not clear, we will play it once again and try to see whether what went wrong or what went right. Okay. All right. Give me a second. Let me just erase these distractors so you can focus. Right. Okay. All right. Starting with the first questions. Okay. All right. First of all, let me just play the audio so I can check whether it's audible for all of you. Here we go.
Practice test 2. Listening test.
Was that audible to all of you?
Yes, ma'am.
Okay. So I'm starting with the audio since we have done a good prediction. I'm moving on to the exact audio. 1 second. 9.
Good morning, Mrs. Croft. I see your GP has referred you to me.
Yes.
Okay. Well, I've got some notes here with his referral letter, but it'd be helpful if you could tell me in your own words the sort of problems you've been experiencing.
Okay, well, I've had high blood pressure for several years, but these last few months that's tending to get worse. I've been on corticosteroids too these last 3 years or so, and that's a result of the fact that I've suffered from asthma since my teens.
I see. But I understand you've developed several other problems recently.
Yeah, as you can see, my stomach is huge. I've put on a lot of weight and it seems to be concentrated there. And, I don't know what's happened to my face. All this hair which has appeared, it's so embarrassing. And something else which I didn't notice at first, but which other people have pointed out to me, here, see, in between my shoulders, is this, well, I can only describe it as a hump. That really bothers me too.
Yes, I can see.
And look at my ankles, they're swollen too. Something else which has got really bad is that I'm also sweating so much, even in cold weather. No amount of antiperspirant seems to help.
Yeah, that must be difficult. And any aches or pains?
Well, my back tends to ache a bit, but I take ibuprofen, which helps.
Good.
My periods used to be painful in the past, but to be honest, they're so infrequent now that the pain really isn't a problem anymore. I often feel tired, though. In fact, like really tired.
And what about your skin?
Oh, yeah. It seems to bruise at the slightest thing. And I've noticed that if I get a cut or a scratch or something, it takes ages to heal. And something else I've spotted on my thighs, see here is these stretch marks.
Ah, yes.
They're quite noticeable because they're a real purple colour. My face has changed too. I used to have quite pale skin, but as you can see, it's quite red now. And it looks, well, puffy. I mean, it never used to look like that.
Okay, so there's been quite a change.
Oh, definitely. And if you look here on my neck, the skin's gone dark. Really odd. I don't know what's happening. And though I never really had it before, I've now got acne into the bargain.
Now, it must all be distressing. I can appreciate that this is having an effect on you. Have you noticed your general mood changing at all?
Well, it's enough to get anyone down, really. And yes, I do feel a bit depressed. But the frightening thing is that I've started getting mood swings. I've never had them before. I mean, 1 minute I'm laughing and the next I'm crying, and I don't know why. It's quite alarming.
Anything else?
Well, I confess I feel, well, irritable all the time. Everything seems to get on my nerves, and I can't seem to concentrate like I used to. I find it hard sometimes to do stuff in my head, like working out a sum or remembering names and things. I just hope that you can find out what's wrong with me.
Well, I'm sure we will. Now, I see you've already had some blood tests, but I'll need to do 1 or 2 more. You've had a urine test to look at your blood sugar, so I probably won't need to repeat that. We may do a saliva test, depending on the bloods.
Okay, I see. And how long will everything take, before we know what's causing the problems?
Well, I'm afraid it can all take some time, as diagnosis can be quite complicated, and we may need to take...
Okay, I'm going to play the audio once again so you guys can check your answers and figure out if you've missed out on anything. Here we go. Let me just take the audio. So I'm right here. Yes.
Good morning, Mrs. Croft. I see your GP has referred you to me.
Yes.
Okay. Well, I've got some notes here with his referral letter, but it'd be helpful if you could tell me in your own words the sort of problems you've been experiencing.
Okay, well, I've had high blood pressure for several years, but these last few months that's tending to get worse. I've been on corticosteroids too these last 3 years or so, and that's a result of the fact that I've suffered from asthma since my teens.
I see. But I understand you've developed several other problems recently.
Oh, yeah. As you can see, my stomach is huge. I've put on a lot of weight and it seems to be concentrated there. And, I don't know what's happened to my face. All this hair which has appeared, it's so embarrassing. And something else which I didn't notice at first, but which other people have pointed out to me, here, see, in between my shoulders, is this, well, I can only describe it as a hump. That really bothers me too.
Yes, I can see.
And look at my ankles, they're swollen too. Something else which has got really bad is that I'm also sweating so much, even in cold weather. No amount of antiperspirant seems to help.
Yeah, that must be difficult. And any aches or pains?
Well, my back tends to ache a bit, but I take ibuprofen, which helps.
Good.
My periods used to be painful in the past, but to be honest, they're so infrequent now that the pain really isn't a problem anymore. I often feel tired, though. In fact, like really tired.
And what about your skin?
Oh, yeah. It seems to bruise at the slightest thing. And I've noticed that if I get a cut or a scratch or something, it takes ages to heal. And something else I've spotted on my thighs, see here is these stretch marks.
Ah, yes.
They're quite noticeable because they're a real purple colour. My face has changed too. I used to have quite pale skin, but as you can see, it's quite red now. And it looks, well, puffy. I mean, it never used to look like that.
Okay, so there's been quite a change.
Oh, definitely. And if you look here on my neck, the skin's gone dark. Really odd. I don't know what's happening. And though I never really had it before, I've now got acne into the bargain.
It must all be distressing. I can appreciate that this is having an effect on you. Have you noticed your general mood changing at all?
Well, it's enough to get anyone down, really. And yes, I do feel a bit depressed. But the frightening thing is that I've started getting mood swings. I've never had them before. I mean, 1 minute I'm laughing and the next I'm crying, and I don't know why. It's quite alarming.
Anything else?
Well, I confess I feel, well, irritable all the time. Everything seems to get on my nerves, and I can't seem to concentrate like I used to. I find it hard sometimes to do stuff in my head, like working out a sum or remembering names and things. I just hope that you can find out what's wrong with me.
Well, I'm sure we will. Now, I see you've already had some blood tests, but I'll need to do 1 or 2 more. You've had a urine test to look at your blood sugar, so I probably won't need to repeat that. We may do a saliva test, depending on the bloods.
Okay, I see. And how long will everything take, before we know what's causing the problems?
Well, I'm afraid it can all take some time.
Okay, all right. Let's start with the first question. 1 second. Yeah. Let's start with the first question here. What is the treatment for 3 years corticosteroid? Asthma. Right, asthma. So any one of you have missed out on that? All of you got the answer?
Yes.
Okay, all right. So that's the answer, asthma. Okay, second one. What is on her face?
Hair.
Hair. Yeah, you can say hair, or you can also say hair growth. Both are correct. Okay, all right. The third one. What is between the shoulders?
Hump.
Anybody have not gotten it? All of you got it?
Second one, ma'am.
Okay, second one. I'll play it. No issues. I'll play it once again. Here we go.
Good morning, Mrs. Croft. I see your GP has referred you to me.
Yes.
Okay. Well, I've got some notes here with his referral letter, but it'd be helpful if you could tell me in your own words the sort of problems you've been experiencing.
Okay, well, I've had high blood pressure for several years, but these last few months that's tending to get worse. I've been on corticosteroids too these last 3 years or so, and that's a result of the fact that I've suffered from asthma since my teens.
I see. But I understand you've developed several other...
So she has told, see, here she mentioned one second.
These last 3 years or so, and that's a result of the fact that I've suffered from asthma since my teens.
I see. But
asthma since my teens. Since she was a teenager, she has been having asthma. So that's the answer for the first one.
I understand you've developed several other problems recently.
Yeah, as you can see, my stomach is huge. I've put on a lot of weight and it seems to be concentrated there. And, I don't know what's happened to my face. All this hair...
I don't know what happened to my face. She talks about the location first, then she says the problem.
Which has appeared. It's so embarrassing.
Once again?
All this hair which has appeared. It's so embarrassing.
All this hair which has appeared. So what is appeared on her face? Hair. Okay? All right. Next one as well.
And something else which I didn't notice at first, but which other people have pointed out to me. Here, see, in between my shoulders?
Ah, yeah.
Again, she mentions the location first.
Is this, well, I can only describe it as a hump.
Hump. Okay. All right. So see, both places, locations were mentioned first. Then, so it's different than what the order is different to what they've given to us in the question booklet. So pay close attention. Okay. Next one. What is the excessive and constant problem she has? Sweating. All of you got it?
Yes.
Okay. All right. Yes. Next one. How does she describe her periods?
Painful.
Let's listen to that. Let's answer is infrequent. I'll tell you why in a second. And I understand why you guys got confused between painful. Let's listen.
That really bothers me too.
Yes, I can see.
And look at my ankles. They're swollen too. Something else which has got really bad is that I'm also sweating so much, even in cold
Sweating so much.
weather. No amount of antiperspirant seems to help.
Yeah, that must be difficult.
Instead of excessive, she says so much.
And any aches or pains?
Well, my back tends to ache a bit, but I take ibuprofen, which helps.
Good.
My periods used to be painful in the past, but...
My periods used to be. We are looking for how is it now? How are her periods now? They've given in the past, it used to be painful.
To be honest, they're so infrequent now that the pain really isn't a problem anymore.
So now they are so infrequent. So now they are infrequent. In the past, it was painful. So answer is not painful. Answer is infrequent. Okay. All right. Sixth one. What did you guys get? Tendency to?
Scratch.
Bruise.
No. Bruise. It's not scratch. It's bruise. Let's listen to that.
I often feel tired though. In fact, like really tired.
And what about your skin?
Oh yeah, it seems to bruise at the slightest thing.
It seems to be it seems to bruise. It seems to bruise. That's the answer, bruise. At the slightest.
And I've noticed that if I get a cut or a scratch or something.
So it seems to bruise. So that's why answer is bruise. Okay, next one. Seventh one. What is on her thighs?
Stretch marks.
No, stretch marks. Stretch marks. Okay, let's listen. Everybody gave me different answers. Let's listen.
It takes ages to heal. And something else I've spotted on my thighs.
Something else I've spotted on my thighs. So she's saying the location first. Let's listen. What's the problem?
See, here's these stretch marks.
See, something I've spotted on my thighs. See here, these are the stretch marks. So answer is on her thighs. She has stretch marks. Okay. All right. What is the problem with her neck? How the area on the neck?
Dark.
Okay.
area.
Yes, all of you got it. Next one, recent development of
Acne.
acne. So just let me play the audio. If any one of you have missed out on it, please pay close attention.
Ah, yes.
They're quite noticeable because they're a real purple colour. My face has changed too. I used to have quite pale skin, but as you can see, it's quite red now. And it looks, well, puffy.
She says face has become red. It looks puffy. She used to be pale. So she's saying a lot of things. As of now, she has not talked about the neck.
I mean, it never used to look like that.
Okay, so there's been quite a change.
Oh, definitely. And if you look here on my neck, the skin's gone dark.
See, she mentions the location first. Then she says skin has gone dark. Okay, all right, let's listen to the acne one.
Really odd. I don't know what's happening. And though I never really had it before, I've now got acne into the bargain.
Now I've got acne. Okay, all right. What is she scared of? Scared by new experience of?
Mood swings.
Mood swings, correctly. Correct. Mood swings, correct. Okay, how does she feel constantly?
Irritable.
Irritable, correct. Her emotion, or constantly she feels irritable. And what type of test? Possible test?
Urine.
No, it's saliva. Okay, let's listen to the all the 10th question, 11th question, and 12th one. Let's listen.
Now, it must all be distressing. I can appreciate that this is having an effect on you. Have you noticed your general mood changing at all?
Well, it's enough to get anyone down, really. And yes, I do feel a bit depressed. But the frightening thing is that I've started getting mood swings.
Frightening thing is that I've started getting mood swings. So instead of scared, she says frightening. So that's what with mood swings. Let's listen.
I've never had them before. I mean, one minute I'm laughing and the next I'm crying, and I don't know why. It's quite alarming.
Anything else?
Well, I confess I feel, irritable all the time.
Irritable all the time. So instead of constantly, she says all the time.
Everything seems to get on my nerves, and I can't seem to concentrate like I used to. You know, I find it hard sometimes to do stuff in my head, like working out a sum or remembering names and things. I just hope that you can find out what's wrong with me.
Well, I'm sure we will. Now, I see you've already had some blood tests, but I'll need to do 1 or 2 more. You've had a urine test to look at your blood sugar.
You have had a urine test. So she has already had a urine test to look at your blood sugar.
So I probably won't need to repeat that.
So I probably won't need to. So I don't need to repeat that. So he's not talking about repeating the urine test. He's like, I won't be needing to repeat that.
We may do a saliva test.
We may do, possible one, may do a saliva test. Okay. So this is how you approach part A. So let's have a quick recap of what we have done so far. We discussed the structure. All of you just go through the structure. And this is the thing that we did today. Prediction. Just go through these. All of you. Since we had done a good prediction, I think other than 3 questions, majority of the other questions, we got the answer. And I've also told about the grammatical clues that you need to, look out for. And remember the location thing that I've told you, the time reference. Please go through all those things. I'll send the material in the group. Along with the same material, there is one more listening. I want you guys to do that as well. That is also an interesting one. Similar rules you can find. So please do that as well. I will send the extra material. Please go through today's listening once again. And if you have any questions, feel free to ask me. Okay, so that's it for today. Any questions before I wrap up? Any questions? Tina, Seema, Anisha, Sindhu, Biji, Cicely, Maria, Rajan. Okay, all right.
No, ma'am.
All right, so thank you. I'll see you guys tomorrow. We will be discussing part B. Okay, all right.
Thank you, ma'am.
No issues, no issues.
Thank you, ma'am.